Namaste, Jai Kali, Jai Mahadev, Jai Bharat. I hope everyone is doing good and taking good care of themselves. Remember, if you're fit and fine, you can take better care of your loved ones. So, today I'm going to talk about depression. A lot of people have a lot of confusion about depression. Some of them, often misunderstand it with anxiety or anxiousness. And there is quite a lot of myths and, wrong information out there. So I have gathered a lot of information which I'm going to tell you with the help of this video. So first, let us understand what depression is. So depression is basically a mood disorder that causes a persistent feeling of sadness and loss of interest. So, I mean, the easiest definition of depression is that it's a kind of a mood disorder where people lose interest, and the feeling of sadness is there for a longer period of time. I mean, like, if the feeling of sadness is there for more than 2 weeks, I mean, this is a usual thumb rule, then definitely those are signs of depression. Now, getting more deeper into the meaning of depression, it's also called a major depressive disorder or clinical depression. So usually we call it depression, but the other ways that it is also referred as is as a major depressive disorder, or it is also referred as clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. So it is not just here. From here, it travels in your behavior and physical problems as well. You may have trouble doing normal day to day activities, and sometimes you may feel as if life isn't worth living. So, these are some of these symptoms or how a person feels when a person is suffering from depression. Apart from that, more than just about of the blues, depression isn't a weakness and you can't simply snap out of it. Depression may require long term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both. So, depression is like not just the end of life, or it's something which is not curable. Definitely, it can be cured, and it can be managed with the help of medication as well as with psychotherapy or counseling support, talking, discussion. There are various ways that you can manage. Now, let us understand what are the symptoms of depression. So, although depression may occur only once during your life, or maybe once or twice, generally it's just once, but people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day, and they may include number one, feeling of sadness, tearfulness, emptiness, or hopelessness. So, I mean, these symptoms, the first one is, feeling of sadness, emptiness, hopelessness, and tearfulness. The second symptom is angry outburst, irritability, or frustration, even over small issues. So I had already discussed it in my past videos also. So any simple thing also they overreact. I mean, that is the symptom. We overreact on simple issues and simple things. There is, a huge amount of mood disorder where we sometimes feel angry quickly and then sometimes we calm down. But I mean, it's like an angry outburst majorly. So it's just, I mean, a very simple thing which irritates and the person becomes very furious and outrageous. The third symptom is that there is loss of interest, in pleasure or in normal activities such as sex, hobbies, and sports. So, if you see out under the influence of depression, people lose interest in their hobbies and activities and sports and even, sexual activities. They lose interest. So this can happen with anyone, and this is one of the symptoms. The next one is, of course, sleep disturbance, including insomnia or sleeping too much. So there is no sleep routine. Either they'll just won't sleep, or they might sleep for too long. So that is one of the symptoms. The other symptom is tiredness and lack of energy. Sometimes we feel lazy. I mean, it's not always laziness. I mean, that is there. It could be an underlying issue with depression that makes us feel very tired, lack of energy, and even doing simple things looks like moving mountain. So that is one of the symptoms. The other symptom is reduced appetite and weight loss, or increased craving of food and weight gain. So if you have reduced appetite, or if you don't feel like eating for long, depression could be one of the reasons. Depression could be one of the reasons for your weight loss. Depression could be one of the reasons of weight gain, whereas in you are doing a lot of emotional eating, and you're eating a lot of junk and bad food, and you're putting on. So that could also be a symptom of depression. The other one is anxiety, agitation, and restlessness. So restlessness is there, agitation is there, and anxiety is there. So depression, if you see, depression, I mean, as I have already mentioned before, depression is a kind of a mood disorder. So, I mean, when there is a mood disorder, there is quite a lot of things. It's not just being angry or being sad, but there is quite a lot of things. Anxiety is there. A person becomes very anxious, agitated, restlessness, and a lot of things, it goes in when it comes to depression. The other symptom is slowed thinking, speaking, or body movements. So, under the influence of depression, of course, people tend to, think slowly. I mean, they become very slow. Their response time is slow. Their thinking way is quite slow. They think less and they think slowly. So, that is one of the, symptoms of depression. The other signs and symptoms are feeling of worthlessness, feeling of guilt, and fixating on past failure or self blame. So, when a person is suffering from depression, they are too much into ruminating the past failures, and also they have this feeling of worthlessness and guilt. So, I mean, all the time there is something that is running in their head, and that doesn't help them. That keeps them fixated to the past, the wrong things, and it takes I mean, it makes the health deteriorate. It makes the mental health deteriorate, physical health deteriorate, and everything begins to deteriorate. And we tend to lose interest in everything that we used to like doing before, but we don't like it now. The other symptoms are also frequent or recurrent thought of death, suicidal thoughts, suicide attempts, and self uh, hurt, anything that self hurt or self harm kind of things. So under depression, also people get all these thoughts of death, and self harm and suicidal thoughts. So depression does make you feel so miserable that we get these thoughts. So that is one of the symptoms. And apart from that, if you see, there are unexplained physical problems as well. I mean, like these depression often manifests in physical problems as well. It's not just in the mind, right? Or how we feel or how our mood is. It often manifests into physical problems like, back pain, headache, and if you see, most of the people who suffer from depression uh, generally have a lot of problem with day-to-day activities. Sometimes either they have got pain, they don't have interest, or they have got headache, or they have got cramps. These could also possibly be the symptoms and the signs of depression. So it's not just in the mind and how you feel. I mean, it manifests as physical problem as well. And you know, some people might just feel unhappy. the saddest part is that people just feel unhappy without knowing that what they are suffering from. So I mean, creating awareness about depression is very essential. Otherwise people just feel miserable and they live feeling that. And I think that really spoils the quality of their life. So definitely, we should create more awareness about the signs and symptoms of depression. Now, let me come to the causes. What causes these kind of disorders or diseases? So, depression uh, has got four major, reasons. I mean, there could be four possible causes of depression. The first is biological differences. People with depression appear to have physical change in their brain. And the significance of these changes is still uncertain, but may eventually help pinpoint the causes. So if you see, there are physical changes also that causes physical changes in the brain that causes depression to happen. So I mean, like, still a lot of research is going on. So I mean, there are physical biological changes that happens in the brain, right? That is number one cause. The second cause is brain chemistry. Now let's understand what brain chemistry are we talking about here in context to depression. So I mean, the neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. So I mean, in recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with the circuit involved in monitoring mood stability may play a significant role in depression and its treatment. So, I mean, if you see the brain chemistry, the transmitters, the function and the changes in the neurotransmitters and the neural network, how they, connect with each other and communicate with each other, that could also be one of the causes. I mean, problem in the brain chemistry, problem with the neurotransmitters, and problem with the neural network. So that could also possibly be the reason or the cause of depression. And still, of course, researchers and scientists are looking into it. But that is one of the causes. First, we understood the biological, I mean, the physical, actual physical changes in the brain. The second is the brain chemistry or the neurotransmitters, the changes in their in the neurotransmitters and the neural network and the pathways that they communicate, the problem in that or the changes in that. The third possible cause is the hormones. Now, changes in the body's balance of hormones may be involved in causing or triggering the depression. So there are a lot of factors that influences or causes depression. Now, coming back to the hormones, hormone changes can result with pregnancy. Of course, there is a lot of erratic behavior, mood swings, and a lot of things happen. I mean, when a woman is ovulating or through pregnancy, that's just an example. So these hormone changes during the pregnancy and during the weeks or the months after delivery, the postpartum that we know, and from thyroid problems also. So I mean, if you see, thyroid could also trigger depression. Pregnancy could also trigger depression, and a lot of hormonal changes can trigger depression, or maybe the lower amount or lower production of estrogen in a woman, or higher excessive production of estrogen, or the lower amount of lower production, I mean, the amount of production of male hormones testosterone, or more production of male hormones testosterone. So I mean, these hormones also play an important role when it comes to depression. So there are a lot of factors. I mean, like, first we have, of course, understood the actual physical, changes happening in the, brain. the physical changes in the brain, that also causes depression. Second is the brain chemistry, about the neurotransmitters and the neural pathways and the neural network. Third is hormones. I mean, hormone plays an important role. And also, you must have seen that during the adolescence and when the person is entering childhood, there is quite a lot of hormone changes, and that brings about quite a lot of mood disorder. So hormone is also one of the cause. I mean, any disbalance can lead to I mean, depression. And the fourth cause that we are looking at is inherited traits. So depression is common in people whose blood relative also have this condition. So to sum it up, there are chemical reasons. I mean, when we are talking about the hormones, the chemical inside the brain and body, that could affect depression. It could be inherited, it could be hereditary, whereas in some family member had, and it's been passed on to you. So that could be one of the reasons. Biological differences, or the biological actual physical changes in the brain, and of course the neurotransmitters. So depression is not just an incident. Let me tell you, it's not just that somebody did something to you. That could be the trigger point, but there is a lot of things that involves, and there is a lot of things that play an important role in the cause of depression. So depression is not just being hurt, but there is series of things that is involved when we talk about depression. Now let us understand the risk factors also. Depression often brings in I mean, begins in the teens. So we see some amount of depression when we were teens as well. And we cannot deny that, but we do overcome. Some still keep fighting with it. But yes, so depression often begins in teens, 20s or 30s. But it can happen at any age, let me tell you that. So it is not just in teens or 20s or 30s. It can happen in old age also. It can happen in mid age also, any time. I mean, like I mean, we have already discussed the cause. So whenever the causes are favorable, or whenever the causes are just right and apt, depression can just set in. So more women than men are diagnosed with depression. So yes, of course, women are the most I mean, like amongst both the genders, women suffer a lot with depression. But this may be due to maybe due in part because women are more likely to seek treatment. So or maybe we can put it this way: women in depression often reach men, sorry, not men, women often in depression actually reach out for treatment more than men. So maybe this I mean, this notion that women suffer more from depression is because it's recorded and women reach out more for help, and men don't reach out for help. So they don't much talk about depression because they're already trapped in so many things. And I mean, society could be a factor, family could be a factor where they don't talk about. So most of the cases were reported from women's end. So yes, I mean, like you can say it's assumed that mostly women suffer from depression, but I think both the genders suffer from depression equally. Maybe men don't talk about it much, women talk about it, but I think men do suffer from depression as well. I have seen a lot of cases. So yes, and now let's discuss about the risk factors. Uh, there could be a huge array of factors that can trigger, the depression. And such I mean, like such factors could include certain personality traits, such as low self-esteem and being too dependent, self-critical, or pessimistic. So this is one of the things that can trigger depression, I mean having low self-esteem and being too dependent and self-critical and pessimistic. So that is one of the factors. The second factor is traumatic or stressful events, like what I told you a while back. So it could be, I mean, it could be anything like a physical or a sexual abuse or a stressful event or a traumatic event, or the death and the loss of a loved ones, a difficult relationship, or financial problem. So all of this can trigger depression if you ignore the signs and if you just keep getting engrossed into it. So the moment you have this sadness, kind of a feeling and losing interest in everything, and if it is persistent for more than 2 weeks, you should immediately seek out help, because those could be the early signs of depression. Now, the other factors are also, risk factors could possibly be the blood relatives with a history of depression, bipolar disorder, alcoholism, or suicidal tendencies. So, these things also trigger depression. These things also accelerate depression in a person, or it triggers depression in a person. Apart from that, in today's time, being lesbian, being gay, being bisexual, transgender, or having variations of development in genital organs, or aren't, or maybe people who are not very clear, who find themselves to be intersex, or who are different and whose preference is different from the majority, and they are in an unsupportive situation. So that also triggers depression. So, I mean, it's a personal choice who prefers what, and I think it's absolutely normal and natural. So, I mean, when we are in a society where everyone is just busy to judge rather than think, you know, and that is where the problem happens, where the other person feels choked, unaccepted. The other person feels a sense of not belonging to the part of the society, or whether they are judged and being isolated or critiqued. So that also is one of the factors that triggers depression, of not being accepted. I mean, we should accept everyone with differences. That is what humanity is, and that is what life is all about. No two people can be the same, or else we would be zombies and robots. So that is the beauty of nature. Everyone is born different, everyone's likes are different, everyone's preference is different. Nothing is something that you come into this world and then become. Now there is a lot of these researchers and things out there that say that, yeah, I mean, you're born gay, you're born this way, you're born lesbian or bisexual or whatsoever, whatever you gender you identify with, or whatever your preference is, or whatever your orientation is. So it's all how you're born. So, I mean, there is no point in making people feel uncomfortable and not accepting them and judging them for being different. I think that is also one of the very harsh truth of our society, because our society is really in a mess because of these things. There's no harmony. And yes, that is one of the factors that causes depression, the not being accepted and being alienated by the society, being judged. So that is one of the factors. Apart from that, history of other mental disorders such as anxiety disorder, eating disorder, or post-traumatic stress disorder. So, PTSD, anxiety disorder, any past history of any of these disorders could also trigger or could be a factor in accelerating the process of depression inside of you. So that is also there. Apart from that, abuse of alcohol, I mean, alcohol abuse or any kind of substance abuse can also, trigger or, cause depression, could possibly be the cause of depression, because alcohol abuse, of course, it changes, it messes up with the chemical balance in your body. Any kind of recreational substance that one consumes, that changes the chemical balance in the mind, and that, I mean, in the brain, and that could possibly be the reason to trigger depression. So yes, a lot of factors are there, and these are some of the risk factors that can accelerate the process of depression. And yeah, so that was there. I mean, like the recreational substance abuse, and of course alcohol addiction. Apart from that, if you see prolonged chronic illness, prolonged sickness like cancer, stroke, chronic pain, or any kind of heart disease, these diseases also, cause or rather could be a risk factor when it comes to depression. Apart from that, certain medications or maybe high blood pressure medications or sleeping pills that the doctor has recommended, or any kind of medication that that can see medicine, and these medications are of course chemicals. So any kind of chemical interaction has the possibility to alter the chemical balance inside of your body. So with certain medications also, depression gets triggered. So it's not just external factors, medicines could also be the reason that certain, chemical interact in such a way that really messes up the balance of the serotonin, dopamine, oxytocin, HGH, any of these chemicals. If there is any kind of a disbalance or ups and downs, or if any of these chemicals just reduce or perish, so that is what can possibly be the reason to cause depression as well. So we have discussed about the four major causes of depression. Now I have just discussed about the risk factors of depression, and now coming to the complications. So depression is a serious disorder that can take a terrible toll on you and your family. So don't take depression lightly, that, oh, it's just a mild mood disorder. No, it can really turn nasty. I have gone through it and I can testify it's horrible to live with depression. And it's more horrible to live feeling miserable and feeling horrible, and out of the fear of being judged, not talking about it. That is even more suffocating. So, yes, depression often gets worse when it's not treated, resulting in emotional, behavioral, and health problems that can affect every area of your life. So, depression needs attention, quick attention, and check. Now, examples, if I have to give examples of the complications associated with depression, include excessive weight or obesity, could be the reason. Could be the reason, or could be because of depression, which can lead to heart disease and diabetes. So these are the, complications associated with depression, or rather, depression causes these, or in a way, if you see, these cause depression. So that is the first thing. The second thing is pain or physical illness. So prolonged pain and prolonged physical illness also causes depression. And if you see, depression can also cause pain and physical illness. So it's vice versa. So whatever I'm going to talk now, the complications, it is either triggered by depression, or because of depression it happens. So yes, physical illness and pain, alcohol and substance abuse could be one of the reason. Either because of depression the person is getting into these kind of abuses, or because of the usage of these kind of substance and alcohol, the person is getting into depression, right? So it's both the ways. Apart from that, anxiety, panic disorder, or social phobia. So either you have all of this because of depression, or you have all of this and you enter depression. So again, it's both the ways. Then family conflicts, relationship problems, school problems, that could be one of the complications. The other complication could possibly be the social isolation or alienation. That could lead to depression, or depression leads to that, right? Apart from that, again, suicidal feelings, suicide attempts, suicidal thoughts, all these kind of thoughts and feelings, come because of depression, I think. And it doesn't go vice versa. Yes, I mean, it comes because of depression. If you are depressed, you get all these kind of weird things. This point, these suicidal feelings. Apart from that, self-harm, you know, self-mutilation or hurting yourself. I mean, that is because of depression mostly. Then premature death from medical condition. So these are some of the complications where it goes both the ways. Either they cause or accelerate the process of depression, or because of depression you get into these things. So that was the complications of depression. Now, see, we have talked about all of these things: depression causes, this, that, jing bang, so many things we talked about depression. Now we need to talk about the prevention, right? And we need to talk about some of the easy solutions that we can do, or we can help ourselves with, or we can help our loved ones with, if we see the signs of depression in them. So the first, I mean, there is no sure, let me tell you this, there is no sure ways to prevent depression. See, everyone's mind is different, everyone's chemistry, I mean, biochemical chemistry inside their mind is different. The structure of their mind, the neurotransmitters, the genes, the hereditary, the situation, everyone's everything is very different. So there is no one way that works for all, right? But there are some easy things that we can do. Now, what are the things that can control or help us prevent depression and also to manage depression? The first thing is, take steps to control stress. You need to understand that stress leads to a variety of problems. And there is one most important factor that leads to stress and us living with stress, and that is our low self-esteem issue. So the moment, or I mean, let me put it this way, in a simple way: if a person is having low self-esteem, that person is bound to be more stressed. So you need to understand, what you need to sort here is to raise your confidence and raise your self-esteem. you know Start feeling good about yourself, see the good things about you, and learn yourself. I mean, relearn, reparent yourself. I know we all are not always taught everything. That is good, that is essential. So that is where reparenting yourself comes into the play. You have to become your own parent. You have to assure yourself. You have to give those affirmations to your own self, that yes, I'm no less, I'm the best, I can do it, I'm not alone, I'm worth being loved. So these kind of motivational and affirmative words is really going to help, and it is going to gradually shift the way how a person thinks. So one needs to work on their self-esteem issues. If they are having low self-esteem, they are bound to be very stressed. So work on your low self-esteem issues, and of course there are quite a lot of medicines also that helps in that. I mean, definitely psychotherapy also helps, but medicine also helps, and that is where the role of a psychologist or a psychiatrist comes in. So I mean, like, therapy as well as medicine both can help you uh, elevate and raise your self-esteem, and not having that low self-esteem problems. The next thing is, uh, reach out to your family and friends and talk about things if something is bothering you. Now comes the problem that the family structures are so dysfunctional and the friends are so toxic and fake that we don't feel like talking about everything with everyone, or rather we are not allowed to talk everything to everyone. But in case if you have a supportive family, you should talk. In case if you have really good friends, you should talk about it. So always address and talk how you feel. Don't just keep inside yourself. Don't just keep anything inside of you and keep ruminating over it. No, just talk it out, right? So that could be one of the preventive things that you can do from really getting into a mess. I mean, mentally, psychologically. So if you feel a certain way, talk about it. Either talk to a healthcare professional, either talk to your friend, either talk to someone who's close to you, either talk to your spouse, either talk to in your family. I mean, if you have someone, and if you don't have anyone that you can rely, of course, then go to a therapist and talk. But talk about it. Don't keep it inside. The more you will keep it inside, it is going to mess up and create a lot of problems. Trust me. The next one, the next preventive things that you can do is that before you have any of those signs, just reach out to medical help, either a psychological help, a psychiatrist, a psychologist, or a mental health care provider. Reach out to any one of them and look for help if you have any such signs. And the easiest one that I told you to look out for is that if you are feeling disinterested and if you feel sad for more than 2 weeks, and if you are losing interest in everything, and if that feeling is persisting for more than 2 weeks, reach out for help. That means there is something wrong. Something wrong is happening inside of you, right? So just reach out for help. And also, depression is something that it just cannot go away like this. No, it takes time. It takes time. You need to know the ways of the long term, management. You need to know how to, create a long term maintenance treatment system when it comes to managing depression. So it's not just that you had a pill and you had one of your counseling sessions and you're out of depression. No, it's quite an ongoing process. So don't hesitate. uh, Discuss these things, and if you have any early signs, please, please, please don't ignore. Just look for help, talk about it, or seek any professional help, whatever you can. But just don't let it keep building up inside. It really messes up. So, yes, I hope I must have brought some clarity about depression. Yes, I have survived the depression. Sometimes I get episodes till now, but I think I'm able to manage it better now. I think I feel good now. I feel there is quite a lot of increase in my confidence, in my self esteem, and I feel good overall. I love doing quite a lot of things. So yes, but yes, I was the only one who identified this problem. I was the only one who pushed myself to seek help, and I'm the only one now who's feeling the difference. And now I think life is good. There is no point, missing out all those good things in life because of depression. So yes, in case if you have any such signs, symptoms, or if your loved one has, please do share this with you and create more awareness. And in case if you have any experience to share regarding depression, please do comment, and please do like, share, subscribe the channel, and lots of love to you, lots of blessing to all of you. Please take care of yourself. May Mahadev bless us all. Please be happy. It's one life. Please be happy. Thank you.